Hi friends, welcome to IPEMA. A big question everybody is asking me, why should I learn PEM method? All of most of us have a fairly a good practice. What is a necessity for learning something new which take lot of energy and time and other things? As you all are in different groups, I am also in multiple groups. The common question we see in groups is what medicine we should give for urticaria, what medicine we should give for corn, warts. And somebody will say, see, I gave Rustox for this. Somebody says, no, give a piece. Give urticaurins for urticaria. So like that, there is like it acted for me. Why don't you try for that also? So in one of the group, there was a lot of discussion happening for urticarial case. Before I come into a main topic, I want to just briefly tell about a case. Then lot of remedies were discussed. So I suggested, why don't we retake the case? Because when I asked for symptom, only urticarial symptoms, nothing else. The doctor who took the case said, no, only this much, this much. I said, no, not possible. See, when we take a case, I personally have two parts. One about chief complaint. They talk about everything: location, sensation, modalities, concomitants, everything. The essence of me, why I did go to learn a lot of other methods is because I didn't know, which I have told many times, I didn't know what to do with the second part, where patient talks so much about their other things. So I was asking, is there anything else patient expressed? So the doctor said, nothing. She said it is troubling her. So what any other symptom, any problem? Because urticaria means we ask for stress and other things. They have some family problems. I don't think that's a reason. Again, unprejudiced observer concept is little coming down. So I said, why don't we take case together? Then we called the patient. So I took all the symptoms of urticaria and my usual question to any case is, I ask, what must be the reason for this problem? So patient said, I don't know. Then she said, doctor, something happened in my family. I had a fight with my son. Okay, why the fight? She said, his wife is also going for a job. He is expecting me to work too many domestic works at home. But I am tired, doctor. She is 70 years old, female patient. So she said, I am tired. You asked me to go out, do any work, go to a bank, go for shopping, or go for functions. I am okay. But doing domestic work really troubles me. Okay. Then what happened? She said, one day where we stay is my house, and I financially help him a lot. I have a daughter also. So I was telling my daughter over the phone everything, whatever happened, fights and my problems, everything. That day, dinner table, I didn't know that my son has put recorder option in my phone. So when we were having dinner, that my son, played that recording. So the conversation between me and daughter was fully recorded in that phone. I was really shattered. I didn't know what to speak on. It is true that I spoke to my daughter. I spoke about my son. Everything is true. But I was really shocked and shattered. So I asked her what may happen, because somebody recorded your conversation and he made everybody to listen. What can happen? Said, with a very great difficulty, this is my kingdom. With so much of difficulty, I have built this, but that is now scattered. I don't know how to fix it. I don't like to work is a different thing, but I am helping him. Now that he has lost my trust. So whole my family is now scattered. I don't know what to do. So after 2 3 days, I developed a severe constipation, and I was in a severe depression. I was not talking to anybody. I was very sad that this happened. I never thought this will happen. Daughter also added all her this, but I wanted only patient's expression. So after taking other symptoms, everything, I asked my friend, tell me what is the remedy. Not interested in work, not doesn't want to do domestic work, everything is leading to sepia. But there are some other things also, which constipation, with sadness, with whole kingdom breaking down, everything led to fabalis, also called as leguminosae. So I gave her some doses of copaiba. Within few weeks, patient completely came out of her chronic urticaria. And there was a lot of argument in the group. I don't have that repertory. See, repertory wise also you can go. But what will you do with the second set of symptoms which I was talking about? What you will do with those things? Since beginning, 2 3 years of practice, I was very happy. Whatever you gave patient was better. They used to come back. It became a chronic patient. But I didn't know what to do with the other set of symptoms which patient is giving. Where do you put this in urticaria? So only after learning sensation method, then sensation method also somewhere I didn't know what to do with some of the, symptoms which says about age. Then PEM is something, opened our success rate. I can really say our success rate in some of the cases now is wonderful. So this is the importance for the friends who says PM is only for intelligent people. It's a joke, ये बॉम्बे वाले इंटेलिजेंट पीपल के लिए पीएम है. The moment you joined homeopathy, you are all intelligent. PM opens a different, path. Not only practice wise, personal development also I can see. Now, if somebody around me, somebody behaves differently, no, I will think, okay, he is or she is stuck in this age. So either they need help or we need to create awareness and tell them, or they need some medicine. And I tell, we all do a lot of counseling, other things. So I tell them, don't worry. Although he's so old, he has fear. It's not the, you need not laugh at them. They have some issues. We will give some medicines. Especially nowadays, you see a lot of dementia and other cases. PM has really helped me in helping those old people. I am really, proud to be homeopath, which I couldn't do through symptom or any other repertorial method. But this has opened ADHD, not only psychiatric. Today we will be, discussing one small condition, which is purely pathological according to you all. So not only there, because we all have our own set of practice. Not we are not specialized in psychology, not specialized in psychiatry, not cancer. We have a general practice where we get all type of patients. So this you can use as a, one a very good tool to help your patients. So sorry, FHPC 5 batch students, I think you have seen this presentation of mine. Once I took class on this, but I thought that this is very, very appropriate for the people who are asking us why PM. When we are already doing our own homeopathic method, why should we upgrade? For them, this is a small presentation. Hope you all like it. So importance of PM learning. I know most of you are very, very serious practitioners. But add one more tool which will help in your practice. So we will restart some problem. Yeah. What is PEM? We all make the journey from incarnation to death. And every one of us is stuck at certain point. For me, maybe a food. See, when my children went to hostel, lot of people spoke lot of things. For me, that food was a very, very important thing. Whenever I call, my question was not how you are studying, what you are doing. Only for this is how good food is provided to them. Now I understand where So each one of us, somewhere, we have some issues in ourselves. So there we are all stuck at certain point. The issues belonging to that point are there from birth till death, unless you help them to come out of that. The core issue, the essence, the one simillimum is the mantra of PM. We have a map in mineral kingdom, but you all know Yakir has done wonderful job in plant kingdom. So we also have a map in the plant kingdom. That was one thing was lacking was in animal kingdom, which our great Dr. Mahesh Gandhi sir has done different animal kingdom map, which where different species are located in a different columns and rows, which is really helping us in our practice. In the case of that urticaria where you felt sepia because she was not interested in doing household work, daily routine work, where you all thought sepia, but somewhere in plant kingdom, I thought it is um, copaiva. Like that, your understanding of drugs, newer drugs, old drugs will really change. You can do lot of you can help your patient in a different way. So what I did was just to understand how PM works. Most of us have anal fissures cases in our practice. So that is what somebody was asking. See, I don't get all that big cases what your Bombay friends get. I get all that small. It's a general practice like any other doctor. So why should I read PM? So I was telling them, see, you get piles, you get urticaria, you get corn, you get. See how many cases of that is better. So they were thinking and they said, better, correct. But somewhere I also feel they are not 100%. See, for me, not only their anal fissures, but as a whole, you should see the improvement in the patient. You can see their growth, the way they behave. Family members will also come and tell, doctor, there is a lot of difference in my daughter or a lot of difference in my wife. So that type of improvement we are not seeing. You are true that they are better. I give him ointments. I give a lot everyday medicine. Since 3-4 months, this patient is 3-4 years. This patient is better, but not 100%. That cure concept I am not seeing. So what I did just to study. We will study together. You all know there is one rubric: rectum cracks fissures. This is and we have 92 remedies. What I did, I restricted them to only a plant kingdom. So I got all these remedies. So you all know Yakir's chart. So I was studying some remedies which comes, you have 6 columns and rows. So what I did, this is for all of you. You can take screenshots. You can also try from your cases. Try for wards, try for piles, try for, then only you will know how important PEM is. So this, I made a chart so that my friends understand what PEM is. And there are 9 rows and 6 columns. What I did from the selected plant kingdom, I took each one remedy from one column. So for first column, that was a hydrastis. That comes between 5th and 6th row. And from the second column, hemamelis, third column, phytoloca, fourth column, pionia, fifth column, retania, and sixth column, colinsonia. They were surprised. They were asking me you see, one more problem in our system is whatever you talk about PQRS, whatever you talk about repertorization, every remedy looks alike. This also has burning, that also has burning. How to differentiate? And how to use the other symptom patient is giving. What my two important question in case taking is, what must be the reason? Second is how it is affecting your day-to-day life. So these two questions usually helps me in deciding age of the patient. So this is what with all the plant remedies, I chose only to study each column one drug. So in short, we will see how this, each column, each remedy, how it works. Maybe fourth column patient may say, when I ask what must be the reason, so he or she may say, doctor, I had lot of chilly things and I got it. And how it is affecting? Doctor, I am a foodie. I want to eat. See this function, that function, who is giving, my friends are giving party. None of the parties I am enjoying. So for taking food has become a big problem for me. So I may think of pioneer because it is nothing related to the symptoms of anal fissures. But somewhere it makes me, it helps me to decide which remedies to give in anal fissure. And remember, all such cases are very, very difficult to treat. It is not so easy to treat normal, like regular cases requires lot of, even dysfunctional uterine bleeding. All remedies look similar, but nowadays it has become so easy for me because I have understood like this. Column wise I have understood. So I hope it will be useful for you also. We'll quickly go into the drugs. Rose, this you will be learning. So each remedy I will tell. And miasm is something very close to my heart. So each plant drug has a miasm. So how to differentiate miasm, how to correlate miasm and age is something we will be discussing in one of the class. So this we will discuss in a class. So we'll talk about hydrosis. When will I give hydrosis is a question. Dryness in the lower part, constipation. This is a common symptom. This is a common symptom you see in all fissure cases. So this is where you break your head. But second one is something very unique for hydrosis. Emotionally sensitive, delicate, and easily offended. When did your problem start? I do, doctor, my husband for everything he comments, doctor. I'm really fed up. Even if I prepare dosa, he says dosa is not good. If I prepare puri, he say puri is not good. I am really fed up since, I got married, I have developed anal fissures. So very, very sensitive patient. Maybe somebody may say, I told my husband, see, I am doing up to my full this. If you don't like, from tomorrow you don't eat. Go to the hotel and eat. Maybe I may think different remedy for such patient. Same situation, different reaction. Your columns are different medicines. So hydrosis is very emotionally sensitive, delicate, and easily offended. Everything penetrates and affects them. Sick when others behave in a less than ideal way towards them. Flooded with emotion when in love. Hence, recurrent disappointed love. Unfull love stories. Particularly affected when such ideal relations have been ended. Woman discovers that her husband has been cheating on her even before marriage. Feeling bleak, humiliated, and rejected. Which book told about this? None of the system told all these things. Only PEM talks about this, which patient has told 100 times to us, which we never thought. This is where PEM helps. We take 2 hours, 3 hours case. I know people who take 3 hours case. But where to put all those symptoms? This is where if you know PM, easily you can understand why this patient is talking about this. Fissures in anus, constipation with sinking feeling in stomach, and dull headache. During stool smarting pain. After stool, long lasting pain. Actually, too much of pain because they have, everything penetrates. Skin is very sensitive. You can think of hydrastis. Column 1, pre-separation, immersed and contained in the feminine principle. While the ego is weak, obscured, dependent, easily influenced, and impressionable. This all in the course you are going to, because in a one, this, it is very difficult to explain. When you join course, lot of things you learn. As I told earlier, not only in your practice, human evolution, no, we also need to evolve. How somebody can be unprejudiced when they have understood themselves well, then only you can be unprejudiced. So this system, as a doctor, in my growth also it helped. So many things, I have also become now, when patient talks, one of the friend was telling, big in the before PEM period, if somebody talks, when it touches you, you cannot cry because you are a doctor in front of patient. So she used to tell, I used to sip water just to, now not like that. You have understood, you understood where your patient stands. So it becomes very easy for your unprejudiced observation. Sorry, some problem. Again, yeah. So column 2, we will take hemamelis. The tincture prepared from the tree resin is used for treating cuts, wounds, and infections of the skin, as well as an astringent. This all of you know. Anus feels sore and raw. The borders are not sound. Borders are formed, but not very sound. Trespassed boundaries. Initially sensitive, sympathetic, and seeking others' sympathy. Trying to find one's place in the world. Feels unappreciated, as if should have been a great person, or as if being patronized and rejected. Doesn't want to feel small. Susceptible to reproach and to being treated disrespectfully. Having their boundaries crossed and gathering strength to grow. Ailments from loss of reputation. Doctor, as a daughter-in-law, I had developed such a good, image in the family. That other daughter-in-law came home, she made my life horrible. My image in the family has gone. This story, otherwise, where do you put? So you have to know where to put, then you should know PM. So this is where HMML is. Even in DUB, you can see some cases where they say, I was the leader of the family, but my daughter-in-law spoiled my reputation. So my DUB started. So such cases you can easily put, is other than giving Sabina unnecessarily, think about Habemelis. Uh, this is an example given by Yakir. Column 2, here or there, neither here or there, between the worlds, boundaries and borders, just separated, fully not incarnated. Initial separation has occurred, but one has not come fully into one's own. Therefore, feeling small, weak, striving to be strong, yet easily failing in achieving this. So for column 3, from column 3, I have taken phytoleka. Phytoleka is one who does. Then she doesn't get any recognition. She loses interest. Then she will come, and you can hear some of the, usually we see a lot of lady patients, we have a lot of stories to tell everybody. So they will say, in the beginning, she was very good doctor. She was doing so much. But nowadays, for everything, she is fighting in the family. She has become, like we are afraid to talk to her. So much she fights. So that is because she has done so much and nobody appreciated her. So in such cases, when you have anal fissures, Think about Phytaloka. Shameless people. That is one more, I have done so much, nobody appreciated. Now I will show what I am. So they lose that delicacy. They became shameless. So when they come to clinic, they say, they just, raise their dress and say, doctor, can you examine? Which, for a moment you will be shocked. But for them, it doesn't matter. So such patient, even in breast cancer, even in all these cases, if patient is little, you feel ye kya, she is behaving like a village lady, which is not very true. But somewhere such patient comes because all these things, it becomes very easy for you. So we are skipping all the column discussion because you will be taught. And fourth column, we are taking pioneer, rectal fissures, constipation, patient bleeding rectal fissures. Strong attachment to the mother. This attachment doesn't allow them to go forward with their life. Worse, since mother's death. Bond of love or hatred keeps the patient chained to the mother, not allowing them to go on. Sleep, sleep disturbed by frightful dreams. Anxious and fearful. Apprehensive if anyone spoke to him. Sensitive to bad news and unpleasant events. The digestive problems involve the lower part of the digestive system, as if the mother's energy turns into dirty experience within them and they can't expel it and be on their own. So as I was telling, my question, what must be the cause? Somewhere after few minutes, no, they immediately say, doctor, I think I never had this problem. After my mother's death only, this problem started. Somewhere I had issues with mother. I didn't convey how much I loved her. Or see, you have lot of other emotions also with the mother. So I think after that, all my problems started. So from column 5, we will take ratania, rectal symptoms with restlessness. See, almost all remedies we got these symptoms. So where do you put your patient? Wet anal fissure with pain like needles. They are sensitive and can go off balance with every stress or a pain. Withdrawal to the point of not being able to speak. Doesn't want to speak. Rigidity. Full of superstitions and fears. Anxiety for family and for others. A fixed idea of fear that something will happen to him if he doesn't do something the way it is supposed to be done. They are so disciplined. They put hot water in the tub, they put medicine in the tub every day, 3 times a day. If you ask same thing to first or second column, they, okay doctor, I will do every time, okay doctor. But you see these column patients very, very rigid, because doctor have told, I have to follow. Such a rigidity you can see in those patients. That is also one of the symptom help you to select. Suppression of anal fissures can be followed by depression. From column 6, I have taken cholinsonia. Anal fissures worse during pregnancy. Why worse during pregnancy? We didn't know. As an adult, it is important for them to be appreciated in the world, to maintain their status at work, something that becomes impossible when they retire. Retirement becoming a period of developing pathology. Therefore, pregnancy is difficult. The woman feels limited in terms of her work. So you have been doing so much, you are traveling so much, you are appreciated in your job so much. But suddenly pregnancy, puts break in your routine. So that causes anal fissure in this patient. Then comes to the sensation of failure, sense of weight in the rectum. They reach stage where they don't know who they are, even having sensation of duality. And this comes with much fatigue, weak and faint feeling. Sensation of sharp sticks in the rectum. Sense of constriction. Worse from the slightest mental emotion. So this, I think, for today, we will restrict our study to the plant kingdom. So I have also done for mineral kingdom, animal kingdom. So you all see this, all of you repetize. Most of us will repetize. But somewhere, no, everything repetization, other symptoms rubric, what we take may mislead us. So if you understand what patient is talking, what is the patient's age, then I think it becomes, you will not ask in a group in a, future, this, what should I give for urticaria? What I should give for anal fissures? What I should give for hemorrhoids? I gave Naxamica, I gave this, that, because you have not picked what patient is talking about. So thanks friends for listening. You have to walk the path to understand what it is. Unless you go and study, you see cases, read Sir's book, whatever I say may not, go into your heart. So happy learning. Bye bye.